You're listening to an Airwave Media Podcast.
Welcome to Unbiased Science,
where we bring scientific method to the madness.
We're hosts, Dr. Jess Steier
and Dr. Sarah Scheinman.
And today we have a guest who honestly is making me feel like the biggest waste of life.
I mean, and to have someone make Jess and myself feel like underachievers, that's a big thing, because neither of us are objectively underachieving here.
So I'm going to read her bio, but we're joined by Suhanee Mitragotri, who is a fourth-year undergrad student at Harvard University. And Suhanee actually reached out to us to tell us about the incredible work that she's doing.
We love that kind of initiative here at Unbiased. We love it when people reach out to us that are amazing.
You know what that's called, Sarah? That's called chutzpah.
It is called chutzpah.
Suhanee has it in spades. So Suhanee, thank you so much for joining us.
Yeah, thank you so much for having me.
And so the topic for today, we're talking about a bunch of different things, but opioids and the opioid crisis, that's really the main subject matter and some of our, responses to the crisis. And Suhanee is really on the front lines doing some incredible things. So let me read this bio. Suhanee is an undergraduate student at Harvard University studying neuroscience with a secondary in global health and health policy. Sarah, it's Suhanee, you cross both Sarah's expertise and my expertise. You're
we were both we need to have this person on immediately.
Yeah. She is also the co-founder of the Naloxone Education Initiative, a program that aims to expand opioid and naloxone education to youth. She has written extensively in science and health magazines on topics related to the opioid crisis, harm reduction, and drug policy. And I was joking to Suhanee, but really it's not a joke, that when I was a fourth-year undergrad student, you could find me in bed cradling a hangover, and here she is just whipping up these incredible initiatives, and it's just amazing. So, all right, let's set the stage. I'm just going to say basically a sentence worth of information to set the scene here and sort of underscore the scale of the opioid epidemic in the U.S. So this is really sobering. We've lost over 1 million lives since the start of the crisis in the late 1900s. And we are seeing a major uptick, or we saw a major uptick in opioid use at the start of the pandemic. And this is likely because more people were using drugs in isolation and because there was a shift to fentanyl in the illicit drug market. Sarah, did you want to jump in here?
I think that maybe it might be a good idea to have our guests just talk to us a little bit about the scale of the crisis. Can you talk to us, Suhanee, a little bit about talk to us about the call to action here. What's happening in our country? I mean, everyone hears about the opioid crisis. It makes headlines all the time. But I don't know if people really understand what exactly is happening here. So can you speak to that a little bit?
Yeah, absolutely. So the opioid crisis has been an ongoing crisis in the United States and also globally. And really, we've lost, as you mentioned, so many lives to this crisis. And it's gone through many different waves, right? So it kind of started with, the crisis started with prescription opioids and OxyContin, and now it's shifted a lot to the point where it's a lot more now based on the illicit drug market. We're even seeing not just opioids, but also other drugs, stimulants, contributing to what we call the fourth wave of the opioid crisis. So really, it's gone through so many different phases. As you mentioned, during the pandemic, we saw a major uptick, likely due to many people using drugs in isolation. And we've also seen so many different responses to the crisis, right? We've seen, increases in law enforcement, specifically at the border. We've seen, investment in healthcare, access, telehealth access to opioid use disorder treatment. We've seen, investment in harm reduction resources, expanded access to naloxone, fentanyl test strips. So really, this crisis has gone through so many different phases, and still to this day, we're losing so many people to the opioid crisis. So there's definitely still a lot of work left to be done.
This is where you came in and founded the Naloxone Education Initiative. That's correct?
Yes, that's correct.
So what is the Naloxone Education Initiative?
Yeah, so the Naloxone Education Initiative is a program I co-founded alongside Dr. Scott Weiner at Brigham and Women's Hospital. And this initiative really aims to expand opioid and naloxone education into high school health classrooms, specifically where I'm based, which is Massachusetts, but we're hoping to eventually expand the scope of our work. But really the goal here is, currently I was in high school about, 4 years ago taking health class, and I was not taught about opioids. I was not taught about naloxone. Despite how pressing this public health crisis is, honestly, a lot of students aren't taught about it. So it came out of this like really gap I noticed in health education currently for youth, and this important need to talk about opioids and naloxone with young people.
Okay, Sarah, you love a definition. Do you want to just take a step back? Like when we're talking about opioids, what are we talking about? And maybe a little bit of a biology lesson. You want to start there?
I would love to. You all know by now, our listeners must know by now that I always love to set the stage with a bit of a definition. And I think maybe now is a good time to let's just start with the basics. So when we're talking about opiates are natural compounds that come from primarily are derived from the poppy plant. And these types of compounds, opiates, are usually our morphines, our codeines, and opioids. Slightly different word, but they're often used interchangeably. Opioids is an umbrella term for anything that binds to what are called opioid receptors that are present throughout our body in our brain. And these can include our natural opiates and also the semi-synthetic drugs like heroin or fully synthetic drugs like fentanyl. So how do opioids actually work in the body and specifically in the brain? So these compounds are going to bind to our opioid receptors. And why it's so dangerous is they bind to opioid receptors. Opioid receptors are very, very prevalent on neurons, our brain cells. And that makes neurons fire less efficiently to one another. So when opioids are present, our neurons are going to be a little less talkative to one another. And depending on where these receptors are located throughout the brain, these effects can vary. So, for example, opioid receptors that are present in our spinal cord, when they're activated, they can block pain signals from actually reaching the brain. And there are also a lot of different areas in the brain that opioids can act on, including a region that's called the periaqueductal gray, which can help shut down pain pathways, and also different areas of our cortex, so the anterior cingulate cortex, or a deep part of our forebrain called the nucleus accumbens. And this is where opioids can also reduce the emotional impact of pain and release dopamine. And this dopamine release is part of what makes opioids so addicting. And that's maybe where, at least at the biological and physiological level, this crisis sort of emerged, because opioids are very, very addicting. And that's kind of the scary part here, and why overdoses are sort of becoming so prevalent. It's very scary, because another component here is that with repeated use, your brain will build up a tolerance to opioids, which means you need more and more of the drug to sort of get that same pain numbing effect. And another question that at least I had when I was first learning about this is why do we even have opioid receptors at all in our brain and in our body? Why are they even present? And the reason is that our bodies produce our own natural opioids, and these are called endogenous opioids. And the most common one that, a lot of you've probably heard of is endorphins. And endorphin actually stands for, and I found this out when I was researching for this episode, endorphin stands for endogenous morphine. So our body is actually producing these natural painkillers. And it makes sense because, we're not always going to have access. Our bodies aren't always going to have access to these poppy derivatives or synthetic opioids. So, we're not always going to have access to exogenous opioids. So when our bodies are in pain, when you hurt yourself, our sensory neurons are going to send pain signals to your spinal cord and your brainstem, and your amygdala, which processes like the emotional aspects of pain. But once the injury is taken care of, it's not so helpful for your body to keep sending these pain signals. So your natural opioids are going to kind of kick in, and that's why your body has this like natural pain killing system in and of itself. But that's not always going to do the trick, right? So that's where the drugs come in. And I feel like I was just talking a lot about. So Suhanee, can you talk to us maybe a little bit? What are the signs of opioid overdose?
You just Midwestern Suhanee. Sorry. No, you said Suhanee. Sorry.
I was doing that earlier when we were introducing ourselves. I was like, Suhanee, like I put that A in a lot of words.
You do. So sorry, you were posing a question to Suhanee. Yeah.
Yeah. My question was, Suhanee, what are the signs to look out for an opioid overdose?
Sure, yeah. So couple of the signs with opioid overdose, and these are also the signs that we talk to students about. One of them is oftentimes when someone is experiencing an opiate overdose, they won't be responsive to noise. So if you're like saying their name, they may not respond, and they also will likely not be responsive to like gentle shaking either. So like movement. Um, Additionally, and this is one of the signs that's like very specific to opioids, is you will see if you look in their eyes, oftentimes their pupils will be very small. We call this pinpoint pupils. Um, and this is quite specific to opioids. And you may even see like, decreased breathing, slower breathing, maybe no breathing at all. This can also, their lips, fingers turning blue or purple. So these are some of the, common signs that we tell students, community members to look for when trying to identify an opiate overdose.
That's important.
I'm itching to switch over to a little bit of a public health perspective, but before I do, Sarah, did you have a follow-up, or can I swoop in?
I think it's so important that you've mentioned the distinctions between opioid overdose and other kinds of drug overdoses, right? Because when we're talking about interventions specifically for opioid overdose, like those things won't necessarily be helpful if you've overdosed on something else, right?
Yes, absolutely. Like especially with like naloxone, it is specifically only works on reversing an opiate overdose.
Okay, I have a bunch of questions, but my first question is, so you started this initiative, which to me indicates that there was a dearth of information on naloxone. So like, what gap is it that your program is addressing? Like, what is it? Where are we dropping the ball?
Sure. Yeah. So naloxone as a drug has been around for a while. But in 2023, some formulations of naloxone became available over the counter. And essentially, what this meant is that anyone can go now into a pharmacy and purchase naloxone to use in the form of a nasal spray. And this greatly, increases accessibility, right? Because now, like, you no longer need necessarily a prescription from the doctor in order to access the drug. However, despite its accessibility, we quickly realized that a lot of people didn't know what naloxone was, didn't know you could get it at the pharmacy over the counter, didn't know what it was used for or how to use it.
I didn't know that you could get it over the counter.
Exactly. Yeah. So even if it's available, if people don't know about it, I mean, there's really no there's not much benefit. So the Naloxone Education Initiative comes from this idea that, okay, naloxone is now available over the counter. Let's educate people about it and make sure it gets into the hands of people so that people can use it when they need to.
So Suhanee, talk to us like we're a classroom of your high school students. What is naloxone?
Yeah, so naloxone is what we call an opiate overdose reversal agent. So basically, it's capable of immediately reversing an opioid overdose. Naloxone, what it does is it binds to these opioid receptors in the brain much more strongly than opioids can. And essentially, what this does is that if someone has opioids in their system and then they're administered naloxone, naloxone will basically displace opioids off these receptors. And in that way, they can essentially reverse the overdose.
Incredible. And Suhanee, so just to confirm, is the naloxone availability over the counter, is that at the federal level?
Yes.
Now, I'm curious because naloxone is available over the counter at the federal level, but there is stigma. It has unfortunately become a controversial topic. And I'm just wondering if there's been pushback at the state level, perhaps from some of the more conservative states. Are you aware of anything like that going on?
Absolutely. And there's been actually research. There's something called like a secret shopper study, and these studies basically aim to like figure out like, okay, in these pharmacies that say that they carry naloxone over the counter, are they actually doing it? And actually, some of these studies have found, um, especially in some of these states that have a larger, conservative population, that some pharmacies, despite saying they may carry naloxone over the counter, don't, or like people will ask for it in the pharmacies and pharmacists will be more hesitant to give out naloxone. So there definitely is a discrepancy. It's not uniform across the United States, despite there being like a federal sort of like requirement for these pharmacies to carry naloxone over the counter.
So dangerous. And can I ask you too, like, is there any kind of an age requirement? Because I know you administer this education initiative at the high school level. So these students, they're not 18 yet. So are they still able to purchase naloxone?
Yeah, so naloxone can be purchased by anyone of any age and also used in anyone of any age.
That's huge.
Such a good question, Sarah. Love that. All right. So, Suhanee, something that I hear quite a bit in our DMs is that the way that the US and in particular the FDA handled the opioid crisis has led to a lot of mistrust in our federal health agencies. And I'm going to pull something up. We'll link to it in our show notes. But there's an article in the AMA Journal of Ethics, and it's the title. This is from August 2020. The title is "How FDA Failures Contributed to the Opioid Crisis." It's authored by a medical doctor. I'll just read the abstract briefly, but there's one thing I wanted to quote here. So, over the past 25 years, pharmaceutical companies deceptively promoted opioid use in ways that were often neither safe nor effective, contributing to unprecedented increases in prescribing, opioid use disorder, and deaths by overdose. So this article walks through regulatory mistakes. And then when I jump down, here we go. I'll just read a sentence of it. The FDA's regulatory failures with respect to opioids have not gone unnoticed. In 2017, the President's Commission on Combating Drug Addiction and the Opioid Crisis found that the opioid crisis was caused in part by, quote, inadequate oversight by the FDA and the National Academy of Sciences. And they publicly called on the FDA to overhaul its opioid policies. And then last year, so that would have been in 2019, a former FDA commissioner rebuked the agency he had previously led, saying on 60 Minutes that the FDA was wrong to allow promotion of opioid use for chronic pain. So I'm curious, as someone who is steeped in this world and sort of the evolution of the crisis and our response, can you comment on that?
So I think there definitely is like many factors involved with the opioid crisis, and I do think like obviously regulatory oversight is incredibly important in something like this, and allowing opioids to be prescribed and distributed so quickly and so easily to so many people, and which led to many people becoming addicted to opioids. I think that definitely contributes to the opioid crisis. I think it's also important to note that the pharmaceutical companies are also very much involved in this crisis, because originally, like, many of these prescription opioids were advertised as not being addictive, like, no, there's no potential for addiction, and because of that, based on this, false information, many providers began prescribing these opioids. Um, and what was unfortunate was, after it became very evident that these opioids are extremely addictive, and there was, efforts to, change prescribing practices. There's been a lot of initiatives to decrease the amount of opioids, or how much opioid providers are prescribing. um, that kind of also led to increased activity in the illicit drug market, because now people weren't able to get opioids through their providers, so they were looking for other ways to get them. So it's really all interlinked, and I think there's so many contributing factors that it's hard to pinpoint the crisis to one specific agency or one specific body. But I definitely do think that regulatory organizations such as the FDA, as well as pharmaceutical companies, played a huge role in this crisis.
One more question for you. I'm sorry, Sarah, were you going to jump in? Can I ask? Okay. So first of all, I want to give a shout out to Dr. Ryan Marino. I don't know if you're familiar with him. He's a brilliant, he's an emergency physician. He's also a toxicologist, and he is very steeped in this world as well. And we've actually had him on the podcast in the past, and we've talked about this topic. He's wonderful. He has a social media presence. Definitely go check him out. But I bring him up because on that episode, we were talking about something that you referenced, that there are these different waves of the crisis. And so can you give us just a little bit of a bit of a history lesson, but the evolution of the crisis, like what's defining these different waves, and where are we now?
Yeah, absolutely. So, the crisis mainly started with prescription opioids, and this was, due to people being prescribed opioids for pain and then becoming addicted to them. And this is sort of, the start of the crisis that people attribute to pharmaceutical companies. And sort of in the early 2000s, there was more attention being given to this and, the risks of opioids and opiate addiction. And there was sort of a decrease at that point in prescribing opioids. Like people were very concerned, providers were concerned. And this is kind of when the illicit drug market sort of became more prominent. Heroin was one of the first opioids that became very prominent on the illicit drug market. And then fentanyl. And fentanyl can actually be prescribed as well, and it is prescribed in clinical settings. But fentanyl in the illicit drug market is often present in uncontrolled quantities. Many of the risks with fentanyl we talk about is one, it's extremely potent, right? So even small quantities can cause an overdose, which is why it gained so much, attention right away. But secondly, a lot of people who are taking even other drugs, like let's say it's cocaine or meth, they can have fentanyl laced in them, and that's another one of the dangers is that people may be taking fentanyl without knowing about it. Um, when we talk with students, we talk a lot about counterfeit pressed pills. These have become very popular in the illicit drug market. These are, pills that look like prescription pills, but they're not. They contain extremely high doses of fentanyl to the point that one pill can cause someone to overdose. And what we're seeing now more than ever with the illicit drug market is that there's, other drugs being involved, like stimulants. People are, a lot of people are taking stimulants alongside fentanyl. And it's kind of changing the way public health response is navigating the issue. So there's been just so many changes, and it's hard to know at any given point in time. That's why there's been increased attention to drug tracking, drug surveillance measures, to see sort of what is in the drug supply in various cities right now, and that has been providing a little bit more information, but still a long way to go. There's so much uncertainty still.
And just a note from the biology side, like one of the reasons why fentanyl is so dangerous is because when I mentioned at the very beginning about the different types of opioid receptors, and you've got, the different types of opiates, you've got your natural opiates, but then you've got semi-synthetic opioids like heroin. Fentanyl is fully synthetic. So that means that its affinity for those opioid receptors that you have naturally throughout your body is extremely high. So you don't need as much of it to get the very strong response from your body when those opioid receptors are activated.
Yeah.
I mean, that's why it's so dangerous. That's why like only a little bit, just goes such a long way. I mean, it's so dangerous when we're talking about these fully synthetic opioids. Not to say that you can't get into a whole lot of trouble with your natural opioids, but
Right. Sarah, I love you and your brain so much. It's not even funny. All right. So, Suhanee, we've talked about your education initiative, but am I correct? Because I believe that you are also involved in advocacy, and you've also, I know, I'm dying over this. Can you talk a little bit?
hear about that.
Yeah, let's hear about that. I'll shut up now.
Yeah, absolutely. So when we started working on this educational initiative to basically get naloxone and opiate education into high schools in Massachusetts, we kind of reached out to some, people who are involved in educational organizations, and we were like, what, how do we make some sort of education mandated or required? And one of the things they told us is, honestly, it's pretty difficult unless it's a law. And so that kind of made us think, okay, like, is there maybe scope here to get, legislation involved? And that's basically what we did. So Dr. Weiner and I worked together to sort of draft a bill that would essentially require all high schools in Massachusetts to teach students about opioids, how to recognize the signs of an opioid overdose, how to respond using naloxone. And, our idea is, students are taught CPR. They're taught that if, someone needs it, they know how to perform CPR and save someone's life. And along similar lines, we're hoping to teach students how to use naloxone. And so we drafted a bill and we, presented it to legislators. And we were very fortunate that they were so supportive. And it was filed in the Massachusetts Senate and also the Massachusetts House in January. And yeah, and so we're super excited, and it's being, considered right now. It'll undergo the whole legislative process. And, it's a long process, but, we're super excited and we're hoping that it goes through and becomes a law so that, eventually every high school student in Massachusetts will graduate knowing how to reverse an overdose and save someone's life.
Okay, I don't know if you know this, Suhanee. I live in Massachusetts and I do have 2 young kids, and I am so hopeful that this will pass and that my kids will receive this education. And I feel like, I don't know, Massachusetts, if it's going to pass somewhere, Massachusetts is a good home for it.
I'm located in Chicago. I feel like this type of educational initiative needs to be present at the federal level. Like, I think all states could benefit from something like this.
Sarah, I have one word, and that word is Godspeed. But I love. I agree.
Now that I'm not involved in things at the policy level, that I just spend all my life in a lab with a little microscope looking at cells, I'm like, can't we just have this everywhere? Like, can't we all just get along? Like,
Suhanee, that is so cool, honestly. And we should talk offline. I'm on the western part of the state, and I do know that it's a problem here. It's a unique population, very different demographics than, the Boston area, the eastern part of the state. It's so needed out here. And let's get the word out about your initiative. So how can people get involved? How can we support? Can you tell us more about that?
Yeah, absolutely. I mean, within Massachusetts, just informing people of this initiative, like specifically getting schools on board has been huge for us, getting town boards of health, community organizations, harm reduction organizations, really getting people behind this so that when it comes to finally, making the case for why this is important, we can, demonstrate that we have a lot of community support. And that's super key. But I think for people like outside of Massachusetts who want to do something similar in their communities, I think the first step is just engaging with schools, engaging with towns across the state, and just, starting these conversations. That was the first step, is just hopping on Zoom meetings with public health officials, school admin, health educators, and just explaining why we think this is important and, hearing them out, hearing any concerns or worries, barriers that there may be. And really being, open to fostering that dialogue. I think that's crucial in any sort of initiative, like community-based initiative like this.
Absolutely. Is there a website? We'll of course include any of this information in our show notes.
Yes, absolutely. There is a website. It's under the Stepping Strong Center for Trauma Innovation, because we're collaborating with them on this initiative. So I can send you that link as well. But yeah.
Amazing. All right, Sarah, did we not cover? Was there anything you wanted to discuss that we haven't covered?
well, I was just wondering if maybe we could sort of end by, Suhanee, can you give us like just a little lesson? Suppose, one of our listeners or one of us is, going about our day, and we come across someone and we suspect that they are having an opioid overdose. What do you tell people to do?
Yeah, so I would say there's 5 key steps that we always teach youth. First is that calling 911 is the first step, getting help on the way. And then secondly, we always, advise people to then check for signs of overdose. So kind of the ones we mentioned before, checking breathing, checking if they're responsive to noise, taking a look at their pupils, pinpoint pupils. Third is administering naloxone. And the great thing about naloxone is it can reverse an opiate overdose. But if you give it to someone who is, let's say, maybe not having an opiate overdose, like maybe they had too much alcohol, maybe they're passed out due to low blood sugar, it won't do them any harm. So even if you're not 100% sure if it's an opiate overdose, it doesn't hurt to give naloxone. And we really like to emphasize this because it can only help. It can't hurt.
It's important.
Exactly. So that's why our third step is administer naloxone. And for students who have like experience with CPR, like they've been trained, we say like you can also start doing CPR because when someone's not breathing, using CPR can also help in that matter. So we say if you're trained, if you're able to, feel free to start doing CPR. And after 2 to 3 minutes, if there is no response, like the person is not waking up, then you can actually administer a second dose of naloxone. Oftentimes when you get naloxone available over the counter, it actually comes with 2 doses. And it's for that reason because oftentimes one may not be enough. And it's completely safe to administer a second dose. And hopefully we believe at that point, emergency services and everyone will be on their way. So those are kind of like the key steps. And administering naloxone itself is fairly straightforward. It's a nasal spray. So you stick it in the nostril and you just push the plunger, and that's it. And we really emphasize how easy it can be to students so that, they feel, empowered to do it.
Is your recommendation that we all like go out and get naloxone and sort of keep it on us? And then a follow-up practical question. Do you have any ballpark idea of cost?
Yeah, absolutely. So I do recommend that everyone carry naloxone, and the availability of naloxone in community settings can vary from state to state. In Massachusetts, we're very lucky that there are so many organizations that give out naloxone for free. Um, we have an organization called UCAN, which basically allows you to order naloxone online for free and have it delivered to your doorstep. And Massachusetts is one of the states that's doing this, but there's other states that are also doing this. And so it's made naloxone much more accessible. In terms of over the counter, it can be expensive, generally around $40. However, insurance can now cover it without copay. But that being said, I think there's such a great need for just ensuring that people can easily access it in community settings. So whether that's libraries, community centers, I know in Massachusetts they're now having vending machines that are giving out naloxone in Boston. So, any efforts like this where people can easily access it for free, I think is crucial.
All right, this is incredible. Suhanee, my mind is going wild with ideas for collaboration to really get the word out about your initiative, maybe do some education via social media. So let's talk offline. But in the meantime, we will link to all of these incredible resources. And we're so grateful that people like you exist in the world and are making real change in terms of education and potentially policy change. So you're just giving me faith in the younger generation. So thank you so much for everything you're doing, and thanks for joining us.
Yeah.
Thanks so much, Suhanee. And thanks to all our listeners for tuning in. We hope you learned a thing or two. Please join us next week on your trusted source for no nonsense, just science.